Now, since I was in the 9th grade, I knew I wanted to become a dentist. In my first semester of dental school, it was clear to me that not only did I want to become the best dentist I could be, but I wanted to make a career out of making other dentists the best dentists they could be. Esthetic Professionals was really created to fill a missing link between dental school and practice. We're trying to teach very comprehensive hands-on dentistry to dentists where they can come and learn new techniques, cosmetic, reconstructive implant techniques. Dentists can come and increase their comfort zone and expand the menu of what they have to treat on their patients. As a result, they have better practices. They're happier about what they do. They get more passionate about their practices. Esthetic Professionals really is in the business of making people more passionate. The bottom line is, these dentists are more successful. The bottom line is, these dentists are treating their patients better. I created Esthetic Professionals to make better dentists. For our demonstration today, we're going to be using electric handpieces. We're also going to be using depth cutting burrs. These are from the Lasco Diamond Company in Chatsworth, California. This is a very clever and useful kit because it has several different depth gauges. We've selected a case that's fairly demanding. It's going to be 6 veneers, and one of the veneers will be covering a previous ceramic crown. Now, we're not making a huge color change, only in the neighborhood of about 2 shades. And so we've selected a depth cutting instrument that's 0.4 of a millimeter in depth. So the first thing we're doing is we're just very quickly placing our 2 depth grooves on all of our anterior teeth. Here you can see the 2 stripes, the red stripe and the green stripe. The red stripe is for the fine diamond on the tip, and the green is a more coarse grit diamond on the shaft. So you can see now clinically when we prepare the tooth, we prepared the gingival finish line, and we've gone right to the free gingival margin. And now when we go interproximal, notice how we're preparing both of the teeth simultaneously. And this is a mistake that a lot of novice dentists will make. So we want to lay that burr right into the contact. We're not breaking the contact, but we're preparing both of our veneers simultaneously. So we're doing our gingival finish line and our interproximal finish line. Now these become points of reference, and when we're doing any kind of preparation, maintaining points of reference are critical. So we've got our depth grooves as points of reference, we've got our gingival margin as a point of reference, and we've also got our interproximal depth groove as a point of reference. Our goal really is to try to do a very minimal prep, and we want to have it just deep enough so we can feel our margin with an explorer, and this means that our lab technician is going to be able to detect it in our impression and on our dies. Once we've established our depth grooves, now we're going to simultaneously remove the remaining portion of this facial surface, and it's important that we go slowly. We're going to remove enamel until we've eliminated our depth grooves. By maintaining plenty of points of reference, we can ensure ourselves that we're not going too deep, or in contrast, we're not going too shallow as well. And again, our depth was predetermined by what we're trying to accomplish in our veneer. In other words, how many shade changes we're making. This will determine how deep we want to go. Once we've prepared the facial surface of our first tooth, we essentially repeat the process on the remaining teeth. I think you can see that this facial reduction can happen fairly quickly. Also notice that we're not irritating any tissues. We don't want to initiate any bleeding if we can help it. Now on tooth number 6, we're not going to be preparing tooth number 5. So we're actually placing our finish line just facial to the interproximal contact. Usually this is the non-aesthetic area, and so in many instances it's not necessary to carry our finish line into that interproximal adjacent to the unprepared tooth. We're not making a huge color change. In this case, it was a very minimal color change because we're only doing the front 6 teeth. And so again, it's not necessary to overextend our preparations because we're going to make fairly translucent veneers, and our margins should end up fairly translucent. Okay, now we're just going back and we're checking our gingival finish lines. Again, my criteria is that I want to be able to definitely feel that margin. And if you can feel the margin with the Explorer, you can be pretty assured that you'll be able to see it in your impressions and on your dies. I call this
Esthetic Professionals, California's premier dental education center. For more information or to enroll, please contact us at 818-654-7100, 818-654-7100, or visit us online at aestheticprofessionals.com.